Welcome to the People of Color Living with Diabetes Virtual Summit. How are you doing, Benicia?
I'm doing well, thank you. How are you?
I can't complain. I'm so excited to be having this conversation with you. Please go ahead and tell the viewers a little bit about yourself, where you're from, and what you do.
Yeah, so my name is Benicia. I am currently a certified exercise physiologist through the American College of Sports Medicine. I work in an outpatient cardiology clinic at a hospital here in Atlanta. My title is exercise physiologist, and so I spend most of my days stressing people out. That's what we call it. People come in and they come and get a stress test, typically patients who've experienced chest pain or other symptoms that might indicate that they have an underlying heart problem. And that also includes patients with diabetes. So I get a lot of patients with diabetes.
I can imagine working for a cardiology clinic that you get a lot of patients that have diabetes. So let's just jump right into it. The segment, and I love the title that you came up with, exercise, the new drug. So
Yes.
let's talk about this, because a lot of people, they hear us harp about diet and exercise all the time, but they may not necessarily know the correlation between exercise and diabetes. So can you tell us a little bit about why we should be thinking about exercise as the new drug?
Yeah, so the big question is, if a doctor could prescribe exercise like he does a pill to help to control or manage your blood sugar, would you take it? And I would hope the question for the answer would be yes. Most of the time when we think of exercise, we just think about exercise to lose weight, to look good in a bikini, or to burn calories. But honestly, there's a lot of things that go on internally inside of our body from a physiological standpoint that actually can benefit us far beyond losing weight or burning calories. Even though those things matter, I want people to start to look at exercise as a drug, as a pill, to help some of those internal functions of our body so that we can control our blood pressure or our diabetes or our blood sugar to prevent pre-diabetes from turning into diabetes. Or for people who are living with diabetes, how can we use exercise to prevent complications from diabetes? So exercise is much more beneficial than just what we see on TV or what we see online. Different social media sites, it might be a little intimidating seeing people exercise to gain muscle and lose weight. But if you look at exercise as medicine, that might give you a little more motivation to get up and move more.
Wow. Thank you. Great answer. And so I'm sitting here, like most people, they only exercise because, like you said, they're going to lose weight. They want to build muscle. Let's just be honest, right? Everybody wants to look better naked. You want to look good in those skinny jeans. You want to try to attract the opposite sex or the same sex, depending. But what you said makes so much sense. If we have that mind shift change where we actually look at exercise as taking that pill. I tell my son all the time when he's sick and he has to take cough medicine or take, children's medicine. No, you don't like the way that it tastes, but you take it anyway because it's good for you. And so that's kind of the approach that I take with my patients when we're talking about exercise. I'm not sure if that's the right approach. So what do you recommend to the client that's so reluctant to get started, especially if we're telling them, well, we want you to exercise, not necessarily to lose weight, but because it's what's best for you, your heart, your muscles, your body, your blood sugar levels and all of that. What do you say to encourage people to get started?
Well, the very first thing is to meet people where they are. I know the benefits of exercise, but for some people, the cost benefit might be too high, where they're thinking, well, if I exercise, that means I won't have time to do X, Y, Z, or maybe I just don't have the time to exercise. So the very first thing would be to educate, for lack of better words. Not that the person is ignorant, but maybe they're just not aware of the benefits of exercise, like we talked about, with it reaching far more than just burning calories. So the very first thing would be to help the person understand the benefits of exercise and how it can actually increase their vitality. It can feel better. That's an automatic benefit of exercise. But then over time, it can also help that patient maybe reduce their medications. And for a lot of patients, that's a motivator right there. It's just the idea of, cutting back on certain medications, working out with other people who share the same complications or who may have the same problems or challenges. You could also encourage that patient, but initially would just be to fully educate and make sure the patient is aware of the benefits of exercise.
Earlier, you talked about the physiology of exercise. So can you speak a little bit about how exercise actually helps to reduce a blood sugar level?
Yes, so exercise actually acts as insulin. So a lot of patients who are diagnosed with diabetes, be it type 1 or type 2, may actually have to take insulin. So exercise works as insulin to help the muscle cells become more sensitive to the insulin, allowing the sugar to flow into the cell and out of the bloodstream. So there's a lot of things that goes on internally from a cellular perspective that exercise is able to initiate or is the catalyst for bringing down our blood sugar and also helping us with other functions in our body, including our blood pressure and our cardiac output. So exercise acts as insulin. It's just one of the benefits.
So I want to throw this kind of monkey wrench in the situation here. Say you've got a patient, type 2 diabetes, 10, 15 years, and they've got, a good level of, a good measure of neuropathy, maybe in their lower extremities, their fingers, their toes, their feet. What do you say to these individuals that they say, I can't exercise, it hurts too bad, or maybe they've got chronic back pain, and whatever the health issue is, they think they're unable to exercise. So are there any considerations for special populations or special circumstances like that?
Yes, definitely. There are several considerations for complications that are associated with diabetes, like you mentioned, neuropathy and having pain in your extremities. So of course, we don't want you to exercise if you're in pain, right? So before, people would say, no pain, no gain. That's incorrect. We don't want you to exercise if you're in pain. So I would say to the individual who is experiencing pain in their extremities or in their limbs, it's okay to avoid activities that cause you more pain. Also, with neuropathy and having loss of sensation in your feet, you definitely want to check your feet each and every day. Check the soles of your feet. Also be mindful of the type of shoes that you wear. So of course, when you exercise, one thing to consider is that some people, their feet swell. So if you're wearing shoes that are too tight or too small, that can actually cause friction on your skin, even if you're wearing socks. And with neuropathy, you may not be able to feel those changes, right? So if you get a cut in your foot, you may not feel that. So you definitely, if you do choose to exercise, if you feel like you can tolerate it, just be mindful to check your feet each and every day. So there's different types of considerations for different types of chronic conditions. So I would definitely recommend, speaking with a certified diabetes educator or someone like myself, an exercise physiologist, who has a little more understanding of the different conditions and how those conditions can actually impair your ability to exercise and also impair your response to exercise. So that includes if you're taking certain medications because of a condition, those medications may actually affect your response to exercise. So you want to be aware of those things. So again, it goes back to just educating yourself and also being your best self-advocate and recognizing that it's okay to have days where you may not feel like exercising, but just knowing that you can have someone to talk to help you to come up with some solutions is definitely a key. So those are just some things to think about.
Wow, you said a mouthful there. So many good considerations to think about for people to have diabetes before they start exercising. I also want to mention, though, not everybody has access to a certified diabetes educator. Not everyone has access to an exercise physiologist. So first and foremost, hopefully you have a provider. Make sure that you go to your doctor, talk to them if you'd like to start an exercise regimen. I think a lot of it also has to do with mindset. And so a lot of times I think we're kind of programmed to think negatively and what we can't do and our limitations, as opposed to saying, I know I have these limitations. Maybe I've got neuropathy, maybe I've got some chronic back pain, but by golly, I want to start this exercise regimen because I know it's going to be better for me, for my health, for my heart, for my blood sugar and everything in between that you've already discussed today. So those are all very, very good tips. One thing I've been doing is asking all of the speakers about their challenges working with people of color, and if that's different than working with individuals that are not from a community of color. So I'm going to ask you the exact same thing. I know you work with a lot of people that have chronic conditions. In your experience, what are the biggest challenges working with people of color?
Okay, so great question, because this is something that I think about on a daily basis. I currently work in a more affluent neighborhood, and the demographics is primarily Caucasian. However, before working at my current location, I was on the south side of ATL, and the disparities are evident. So working with people of color definitely was challenging, but not from a standpoint of they, were worse patients or anything like that. It was just the lack of resources, the lack of education. And I'm not talking about school, I'm talking about just the lack of understanding and knowing and understanding their condition and having that relationship with the doctor. Our history with medicine is not the best, when we consider, Tuskegee experiments and Planned Parenthood, and you talk about eugenics. So the relationship between the doctors sometimes was challenging, and I would have patients who would definitely come to me because they see me as a woman of color, and they're venting to me about the doctors and how they feel like the doctors don't hear them, or even some of the nurses. So just seeing the disparities from a broader perspective, not just specific to their condition, but just them as people of color and the challenges that they face compared to the challenges that the patients face at my current location was definitely eye-opening. So the patients now, I would say the patients I have now, they're not as sick. And I say this all the time because it's very interesting to see how I went from like a secondary prevention type of scenario to a primary prevention type of scenario. So I think that's another difference in working with people of color. I think we catch it a little bit later. Yeah, the patients.
You just opened up a whole can of worms, girl. Yes, I'm sorry. I don't want to cut you off. I've been wanting to interject here because one thing that you said was, and correct me if I'm wrong, you said it's not that they're necessarily worse patients, but they have a lack of resources. And I think that's so key when we talk about healthcare disparities and having worse outcomes. I know there's a lot of things that go into play, right? There's a lack of trust of the healthcare system for some of those reasons that you explained. There's certainly some unconscious bias on behalf of the healthcare providers as well, but the lack of resources is key. And then you also talked about how you went from, where you were primarily practicing secondary prevention. And for our viewers that don't know the difference between primary prevention and secondary prevention, when we talk about primary prevention, we're talking about doing those things that prevent or ward off chronic conditions. So that's when we provide education to teens to not smoke. That's when we provide education to young people to use condoms if they're going to have sex so we can prevent teen pregnancy. That's when we're doing all of the things early because we don't want something to happen. When we talk about secondary prevention, by this time, you've already been diagnosed with high blood pressure. You've already been diagnosed with the diabetes. So now the interventions that we are going to provide to you from a healthcare or public health standpoint are going to be monitoring and maintenance to make sure that your condition doesn't get worse. And I think that's so key that you said that. And so my question to you is that secondary? I know that you said that you feel like it's because Black people go to care late. And I would say that's probably very true in a lot of communities. Do you think that has anything to do with the actual healthcare system as well? Do you think they take a different approach? And if there is, and the reason I'm trying to ask is because if Black people or brown people, people of color in general, are seeking or entering care later than our, Caucasian counterparts, is there something that we can do as healthcare and public health individuals that actually seeks them out and goes to find them to provide those primary prevention services? I'm just asking here for your opinion and what you think.
Yeah, no, definitely. I think there's something that we can do, and that's just getting the word out, talking to people, seeing first, like you said before, do you have a primary care provider? When's the last time you went to the doctor for a wellness check? A lot of times, we'll put off going to the doctor when we feel well, even though that's covered through most insurances, to be able to receive that one visit annually just to make sure that you're well. But we'll put it off because we don't think it's important. We think we feel well, not realizing that our well is not really well. We just got used to feeling sick. You know what I mean? So by the time it hits us hard. And then we're faced with going to the doctor, like you said, for that secondary prevention. But I do think us as health professionals and health educators, it starts with first going out into the community, making sure people are aware of their benefits. If they have insurance, make sure they're aware. There's also a lot of different organizations that provide access to care. And speaking of access to care, that's the biggest thing. It's just increasing access to care and make sure that people are aware of those opportunities. So catching it early means having a primary care doctor, going to your annual checkup visits, and just being on top of your health. So there's a lot of work to be done, a lot of footwork to be done, but I think with the help of social media, there's so many different outlets to get the word out and help people to understand, like, your health. You have to become a self-advocate for yourself, and that begins with finding yourself a primary care doctor.
Absolutely. Wow. I know we're trying to keep this to about 30 minutes. I could just go on and on and on about this topic because everything you said has been so spot on. You were talking about, I personally believe this to be true in the Black American culture, especially in the South, because that's where I'm from, that there is, especially as it pertains to people with diabetes, because, you can't tell you have diabetes. Like, you can't look at someone, you can generalize by, their makeup, their body composition and all that, but you really just can't see diabetes. So people assume because they look well, they've got all their limbs, even though they're a little sluggish and tired, but they're able to go to work every day, they're okay. They're not sick, like you said, but they're not necessarily well. I know I've had clients before when we have this kind of discussion about health and wellness and what, the different terms mean. For me, I've actually come across Black and brown individuals that kind of equate wellness to whiteness. And I don't know if that's something that you've come across before as well. I know personally, I moved to Austin, I took up hiking, and I got like, Black people don't go hiking. What are you doing? That's not, we don't do that. And that's kind of, the attitude I've got, like, well, where they do that at, where only a certain population can participate in certain activities. And I think as a people, we've got to do better, but I think, there's several layers of that. And I think there's got to be an approach on all of those levels of the socioecological model to really make a dent in our outcomes. That's so good. Such good response. I want to transition now because I know you promote exercise prescriptions. So tell the viewers, what exactly is an exercise prescription, if it's something they should inquire about from their doctor, and what should they expect if they ask for one?
So exercise prescription is still, it's not new, but the concept of incorporating it into a doctor's office is still relatively new. When we talk about like medical health records and doctors talking to their patients about exercise, that's still not really something that is encouraged, because as it stands, there's no reimbursement. So there's no real benefit for providers to provide exercise counseling for their patients. But like I said, if you speak with an exercise physiologist, or if you can, get a referral to a CDE, a certified diabetes educator, you can speak to them about exercise, like you said, based on your conditions and what's the best, the best structure for you so that you can increase your physical activity levels to prevent chronic conditions or treat your current chronic condition. But exercise prescription itself is just like a pill. Just like a doctor prescribes a pill, we can prescribe exercise as medicine. So when you take a pill, typically it tells you the dose, how much of the medication you're supposed to take, how much or when you're supposed to take it. And it's the same thing with exercise. We apply the FIT principle when prescribing exercise. So FIT is FITT. So the F stands for frequency. So just like a pill, you have the number of days or how often you're supposed to take it. So with exercise, I can say, okay, the frequency is 2 to 3 days a week, right? So then the next thing is intensity. So intensity would look something like the dosage, right? The amount that you're supposed to take. So, or how hard you're supposed to work out. So the intensity can be either light, moderate, or vigorous. So then we can base it again upon your current activity level and your limitations and special considerations to prescribe the intensity. And then T, the first T, stands for time. So how long are you going to exercise? For 20 minutes, 30 minutes, 10 minutes, 3 times a day for a total of 30 minutes for that day. You decide between you and the exercise professional. And then the final T is type. So that's the mode of exercise. What are you going to do exactly? Are you going to choose cardio or aerobic heart pumping exercise, like riding your bike, going for a walk, going to the pool, doing a couple of laps around the pool? Or are you going to choose resistance training? And if so, what type? Resistance, it could be anything from lifting weights like dumbbells, or just using your own body weight like doing squats. So just like a pill, we can prescribe exercise as medicine where it's specific and tailored to the individual. So exercise prescription is individualized, and that's the great thing about it, especially when you're talking about special considerations for chronic conditions.
Wow, thank you so much for explaining it that way. Everybody run out and go ask your doctor for your exercise prescription. I think we all need that, not just people that have diabetes. Wow, this has been, you've been a wealth of information, seriously, Benicia. I want to ask you, what's that one piece of advice that you would have for people that are living with diabetes, wanting to incorporate exercise into their daily life?
For people living with diabetes, the key is to know your numbers, okay? So when you're exercising or before you begin any exercise regimen, make sure you understand what it means to be high and what it means to be low. Because just like I mentioned before, exercise works as insulin to lower your blood sugar. So if you're not aware of what your blood sugar is, you really don't know what impact exercise is having. So if you're taking medications and your medications are working to keep your blood pressure or your blood sugar low, you definitely want to know before you exercise what your numbers are. Just a rule of thumb, if it's less than 70, do not exercise. Drink something, wait for a little while, and check your numbers again. So again, just being a self-advocate for your health, knowing your numbers, and then taking the necessary actions to control your blood sugar through daily physical activity.
Wow. Thank you so much. Very, very good advice, very sound advice from an expert indeed. Benicia, can you please tell everyone where they can connect with you if they would like to after the summit?
As of right now, you can find me on LinkedIn. It's just Benicia Malone on LinkedIn. I'm very active on there. If you have any questions, feel free to send me a direct message and I'll respond to you as soon as possible. I have a huge passion for helping people become better self-managers of their health. And so I want to encourage and empower each and every one of you to, take control of your diabetes, take control of your health, and use exercise as one of the many tools to manage your health and your health outcomes. So, Benicia Malone on LinkedIn.
Y'all, everybody go and run and connect with Benicia. Benicia, your passion shines through. Thank you again for being a speaker for the people of color living with diabetes virtual summit. I will talk to you again very, very soon in the near future.
Thank you so much for having me. It was a pleasure. I'm so honored that you had me, and I hope to work with you again in the future. Thank you.
Absolutely. Take care. Talk soon. Bye-bye.
Bye.
All right.